Good afternoon, everyone, and a very warm welcome to our micro-credentials lunchtime series. This is the second webinar in our series, and today we're going to focus on enhancing your clinical skills. It's great to see such an interest in this topic today, and the whole clinical area is a space where Trinity really is a research expert and a thought leader. So I'm delighted today to be joined by two of our micro-credential course directors who I'll introduce shortly. But first of all, I think it'd probably be best if I introduce myself. My name is Orla Bannon. I'm Head of Trinity Careers and Development, and I'm also the Programme Director for all micro-credentials at Trinity. So my team and I work with academics and with micro-credential learners to really prepare for the micro-credential journey and to make sure that journey through the micro-credential is as efficient and as rewarding as possible. So as I said today, delighted to be joined by two of our micro-credential course directors, joined by Cathy Roets. Welcome, Cathy, from our School of Nursing and Midwifery. And Cathy is the director of one of our most successful micro-credentials, which is the MC in Application of Simulation Practice in Healthcare. And also delighted to be joined by Romero-Ortuno. And Roman is from the School of Medicine, and he is the course director for a new micro-credential that's launching in September, which is the MC in Assessment and Management of Frailty in Aging Adults. So in a couple of minutes, I'll be having a bit of a chat with Cathy and Roman about their micro-credentials in general, and really to give you a sense for what they're about and how they can really help develop and enhance your clinical skills. But first of all, I just want to make sure we're all on the same page about what a Trinity micro-credential is, so it's really clear. So micro-credentials at Trinity are short accredited courses that last between 5 and 12 weeks. So what accredited means is that by doing this micro-credential, Trinity gives you recognition for that learning and having completed the assessment. So that's what you're getting. You're getting a validation and a recognition by Trinity. That's what accreditation means. Each micro-credential then has kind of a learning component to it, and you get recognition for that learning. And that's done in components called ECTS. So all our micro-credentials are either at 5 ECTS, which means there's the equivalent of 125 hours of learning in that, or 10 ECTS, which means that's 250 hours of learning that you'll get credit for. All our micro-credentials are at level 9, postgraduate level. So for most of our micro-credentials, you need to have a level 8 undergraduate qualification or significant relevant experience in a professional area to allow you to access the micro-credential. And the key thing about our micro-credentials, and I think this will come up during our conversation today, is they've very much been developed in response to identified skills needs. And we'll talk a little bit about the drivers of that in the clinical area. And as I said, Trinity's areas of research expertise. So that'll come out a little bit more in our discussion. Some of you will be aware that there currently is a fee subsidy available for micro-credentials. So I just want to touch on that quickly now. So these are all the micro-credentials that Trinity has available in the healthcare and the clinical space. They're all entitled to a 50% fee subsidy for 24-25. So we'd invite you to have a look through all of those, see if they're of interest to you, and just for you to be aware that fee subsidy is there. How you apply for the fee subsidy is that you need to apply for the micro-credential first on the Trinity website. Once you get offered and accept your place on the micro-credential, you will automatically be invited to apply for the fee subsidy and check to see if you're eligible against the eligibility criteria. So you can't just apply directly for the fee subsidy. You need to apply for the micro-credential directly first. And we'll give you some further information at the end of this webinar as to where you can find some more detail. So as we go through our discussion, you may have some questions that might come up. So you'll see a little Q&A button down the bottom of your screen, and my colleague Aggie is here with us today. He's going to keep an eye on that Q&A, and we'll come back to that at the end and hopefully address any questions that you have. So Aggie, if I can ask you just to stop sharing the screen there, and maybe we'll move guys just into having a little bit of a chat about micro-credentials at Trinity. And I suppose when we think about enhancing your clinical skills, Cathy, I might come to you first, is really what is the driver for the need for people to upskill in this area right now? What are you seeing as the main drivers in your area for people to upskill?
So I suppose my micro-credential is around simulation, and simulation has become a key driver with regards to the whole remit of patient safety. So we are trying to promote patient safety within the hospital, clinical environments. That could be hospital, that could be universities, that could be, and so basically we are trying to promote the whole concept of education using simulation to upskill so from my perspective, it's upskilling the educators to be able to use simulation in their healthcare settings to be able to promote patient safety.
Okay, thanks for that, Cathy. And Roman, I'll come to you next. I mean, you have a new micro-credential in the area of frailty, and I'm just wondering what was the driver. Is there any national strategies or policies that have really helped informed the drive for this new micro-credential?
Thank you very much, Orla, and hello everyone, and thanks for having me here today. And so yes, the main driver really is that we'd like, our older adults to be looked after, properly wherever they are. And frailty is a concept that's been talked about an awful lot, both in clinical practice and in policy. And you may have heard about frailty-related services and frailty pathways, and the national team for older people. So the national program for older people has launched some documents as well, that there is a national frailty education program. So all these things have resonated a lot in the context of an aging population, so that we have taken good advantage of that in Trinity, really to condense the main bits of knowledge that are practical and focused on healthcare professionals to understand the concept of frailty, what frailty is and isn't, but also what is the evidence base behind many frailty tools, advantages, disadvantages, and how to incorporate that into the care of the aging adult wherever the setting. Could be hospital, could be nursing home, could be community, could be primary care. And also what we really value as well, and thanks for Cathy to present as well her micro-credential, is that we really like to cater for an interdisciplinary audience. So we look at healthcare professionals that work with aging adults, older adults in any settings, and we really are interested in capturing the interest not only from medics but also from nursing, allied health and social care professionals, managers, so anyone who's really interested in upskilling in this new concept.
Okay, thanks for that, Roman. And I think it brought up an interesting point. And I mean, we're coming into our 4th year of running micro-credentials now at Trinity. And one of the biggest feedbacks we've had as the central team from learners is how much they've learned from others in their class. Most of our micro-credentials, as Cathy and Roman have said, are interdisciplinary, particularly in the clinical space, where that's the way we all work in the clinical environment. And I think that that's really the feedback we've gotten, that, you learn a lot, obviously, from the person who's leading the micro-credential, but from the sharing of experiences from peer-to-peer learning is a huge part of micro-credentials. Because as you said, Roman, such a diversity of profiles of learners coming in to do the micro-credentials. And maybe, Roman, I'll just stick with you for now, is about what makes Trinity a leader in this space? I mean, frailty, as we hear this a lot. We know about the new national offices. We know what's happening in hospital level. But what is Trinity specifically doing in this space that feeds into this micro-credential?
Thank you, Orla. So Trinity has a wealth of partners in the healthcare space. So there are, a lot of university hospitals affiliated with the Trinity network, and a lot of academic that are also healthcare professionals, and that they do really get up to date, and they have a good understanding of how things look practically on the ground. So I think really Trinity capitalizes on that this is not only like an academic micro-credential, like an academic course, but it also brings some practical insights into it from people who know the practical space. And also, as you say as well, is interdisciplinary. So I think really there is a lot of existing, resource in Trinity to be able to channel that into something that's practical, that's actually, digestive, that actually is bite-sized, but it's high quality, and also it's up to date. Because these are spaces that are moving on very quickly, and even the way we deliver micro-credential in 5 years will be different from we will do this year. So even you think about the possibility of even taking this micro-credential more than once, because we do try our best to really incorporate new developments into the curriculum every year, and this is a very fast-moving space.
And I think that highlights one of the advantages of micro-credentials, and we'll talk about the delivery and the assessment in a little bit, but how flexible they are, particularly in the clinical environment, as you said, where the kind of the research is moving fast and the practice on the ground is moving very fast. Cathy, I might come to yourself just in your area in the School of Nursing and Midwifery about what is really making Trinity a leader in the space that you're teaching in at the moment.
Yeah, so we obviously have a simulation suite. So we're very fortunate to have a simulation suite within the School of Nursing and Midwifery, and we run simulation from an undergraduate to a postgraduate. We do it for some partner hospitals. We run some simulation for them. We run interdisciplinary simulation. So we've got a lot of experience within simulation. And I suppose from our perspective, there was a huge need and a huge drive to try and give some of that knowledge back to our clinical partners, and so we have brought all of our experience, but as Roman has suggested, it keeps on changing. I mean, when we originally had started this micro-credential, we thought it will all be simulation-based simulation, and it's now changing so dramatically that we actually are looking at other ways. And they talk about standardized patients, which are actors within the role of simulation. We're using a lot more of that because of the diversity of the people that are coming to the micro-credential. So I mean, we've got medics, we've got physios, we even had clinical scientists last time around. So we have a huge different experience being brought, and we're learning from that all the time. So the micro-credential is constantly changing, as Roman has suggested, because of feedback back from the learners, but also because we notice things. Like one of the things that I noticed was people were struggling to write scripts. So I'm looking to try and actually have that as just a presentation within the micro-credential on how to actually write scripts, which I didn't think originally when I started that this would be something that people actually struggle with, So the micro-credentials are constantly changing. The feedback back from the learners, we take that into account, and we try and adapt it. But as you had mentioned, the learners are learning from each other as well, and the interprofessional element of it is huge. And I mean, it's actually lovely now that we have got such an interprofessional element as part of the micro-credential in the application of simulation in healthcare, which really, really benefits the learners.
Thanks for that, Cathy. And in terms of your micro-credential, in terms of the delivery and the assessment, how is that different than, you say, someone who comes in to do a master's course or something like that? What's different about the micro-credential?
So we obviously have taken into account that we need to be able to facilitate learners from all over the country. So we have 3 face-to-face days, and they're a month apart, that we meet face-to-face. Those are really, really beneficial. That's when we do our hands-on skills. That's when they meet each other, they get to know each other. But we're very much conscious that, these are very, very busy healthcare professionals who are key to their healthcare facilities that they're working in. They're taking a huge amount of time off work. Doesn't really suit the majority of them. So that's really, really helped, is that we only have the 3 face-to-face days. They full-on days, they're practical hands-on days. We have 2 online live learning days where we've got experts in the field of simulation from the world. So it's not just, and that enables us to do that. And then we have online self-directed learning modules that the learners can do in their own time. So it means that it's a real mix of how we deliver it. And it means that a lot of the theory is done via the self-directed learning. And then the face-to-face days is about learning the skills to be able to do simulation, as well as getting experts in the field to be able to come and talk, that it's not just coming from us in Trinity, that this is something that is the experts are bringing from their countries that they come from.
Okay, that's great, Cathy. Thanks. And great to understand a little bit more about the delivery. In Roman, in terms of your new micro-credential, I know it's just launching in September, but in terms of how the micro-credential maybe differs from other types of delivery or other types of teaching that you're doing, can you tell us a little bit about the delivery and the assessment for your micro-credential?
Yes, thank you, Orla. And I agree with Cathy that as well as, self-directed learning, which means that, you do that in your own time and you're watching a recording or a set of materials, that the online live educational component is fundamental, because the way I perceive our target audience, they really want to have that live experience. And many of these topics are quite reflective in nature. And in terms of our delivery, we like to hear the views of our students as well in a live way. So in our micro-credential, actually, the majority of the content is live educational, right? So these are 10 sessions, 2 hours each, Tuesday afternoon over term time, spread over the first semester. And many of the students that take this type of courses tell us that actually, look, they've agreed with their manager to take those 2 hours on a Tuesday afternoon, and they know that's for education. And they feel empowered to really kind of expand their professional development, but also they feel protected in that education time, because no one wants to get home after a very busy day and confront those long hours in the evening, which we should be doing other things with, really. So for me, it's reflective learning requires really the left educational component. So we prioritize that over the self-directed learning. So that's something that really facilitates and also empowers our students, to release themselves for that educational activity. The other thing to say as well is that the accreditation for continuous professional development is there too. So we've talked about the ECTS. ECTS is these kind of university credits that count in other universities in Europe. So there might be a future, not yet, but perhaps there might be a future where people who have accumulated ECTSs could build up flexible degrees. And that's a future that perhaps, might come one day. So if you can stack micro-credentials, you could build flexible degrees. That's not a reality at the moment, but it's a vision. It's a vision and perhaps a reality in other places, but the idea is that we could really look at accrediting micro-credentials as well with continuous professional development points. So in our space, we've secured already accreditation from the Royal College of Physicians in Ireland, 20 credits for the life educational component. We're also waiting to hear from the Nursing Midwifery Board as well to go on the minor award list. And also we know that the National Health and Social Care Professions Office has offered sponsorships for the micro-credential as well. So that we have had buy-in, from the regulators of continuous professional development across the disciplines. And, even though you may not be primarily interested in building up degrees in the future, etc., but if you are looking for CPD credits, for your professional progressions, those are very suitable as well. So I'd argue that micro-credentials offer that, and you could clear a lot of CPD points at once in an area that you're really interested in.
And I think that's that's particularly relevant for this audience in the clinical space, because I know even with yourselves, Cathy, as well, that whole area of CPD for every part of the clinical professions is compulsory. So I think, to be able to kind of kill two birds with the one stone, you get your Trinity credits, plus you also get your CPT credits with your professional accrediting body, kills the two birds with the one stone. One of the questions, I'm just going to move on. Thanks, Cathy and Roman, for those insights. I'm just going to move on. We just have a couple of questions coming in on the Q&A. So you know, one of the questions that we always get asked for micro-credentials is, well, that's all great. And particularly where maybe someone wants to contact their employer about sponsoring them to do a micro-credential. And just for people to know that about 60% of our learners at the moment are employer sponsored on micro-credentials. About what direct impact does doing this micro-credential, what direct impact will this have on my workplace? So Cathy, if I'd come to you, if someone came to you and said, okay, I'm interested in doing your micro-credential, but what direct impact is that going to have for me when I go back to my job in two or 3 months' time?
Yeah, and I suppose, you know, when it comes to simulation, people always think they need to have a huge amount of funding to back them up with regards to simulation equipment and stuff like that, because simulation equipment is expensive.
Mm-hmm.
But to be honest with you, they can come in with very little equipment that they have available within their healthcare environments. It could be something like a task trainer. It could be actors, as I mentioned, the standardized patient. So you basically, when you come in onto this micro-credential, we teach you how to write a scenario planning document. So basically that is actually taking whatever, so you basically decide whatever area you want to do simulation, because you know there's a need for that simulation to be done within your healthcare setting, and you develop it based on that need that you have within your healthcare setting, and you then can take that back to your hospital setting or clinical setting and implement it. So whatever need is there from a patient safety perspective, it could be something like sepsis screening, it could be something like delirium, it could be, you know, so, and it's trying to teach the learners or the healthcare professionals how to use these tools that are available to them. And a lot of it is about frameworks that are there already, guidelines that are there, and it's how do we use those to teach our learners how to use those tools correctly.
Mm-hmm. And I might maybe ask the same question to yourself, Roman, about, you know, that you know, I'm interested in doing your micro-credential. What impact is it going to have for me in 2 months' time when I'm finished and I go back to work? What difference will it make?
Well, Cathy's explained it very eloquently, so I agree with all what she said. I suppose, you know, also to reflect on the concept of confidence in the workplace, right? And being up to date. So I think that's really kind of what Cathy also implies, that we go back to the workplace and we've acquired new knowledge and we know that knowledge is up to date. We understand the concepts a little bit better, so we get more confident. Actually, when we hear in conversation or perhaps from other professionals certain ideas or certain labels or certain topics, that sometimes we just go away thinking, well, I may not say anything or might not get involved in this because I just don't really know what they're saying, or perhaps it's going to show that I don't know. And sometimes we're not confident, you know, kind of contributing when we know we could actually contribute positively to patient care. Sometimes, you know, a micro-credential would enhance your confidence in getting involved into aspects that you believe in, and really make your professional practice much more rewarding, but also increase your dialogue with the other professionals as well, especially in this area of interdisciplinary learning, where tools that other people use may not be the ones that you use, but then having gained some knowledge on those, you know, changes your perception of how you could contribute, and especially when it comes to the care of the older adults, where everyone has something to say, but I think it's about how you understand what other people are saying as well. So that confidence is really what you can expect from a micro-credential.
I think that's really insightful. So thanks to you both for that. We've had another question just about the assessment and the assignment side. And I suppose one of the things I want to make clear is, obviously, as both Cathy and Roman have indicated, there is a theory aspect to the micro-credential, but then also a very practical applied aspect to the micro-credentials as well, particularly in terms of the assessment. And that's one of the big differences, I think, between micro-credentials and maybe our more traditional offerings in Trinity, is that the assessment side is much more practically and applied focused. And the question was around, is the assessment mandatory? And I'm coming back to what we've been talking about earlier, is to get that accreditation for your learning at Trinity, you are required to complete an assessment to get the credits. And that would be common across all types of learning. To get that accredited recognition of your learning, you will have to complete the assessment. So maybe I might ask you just quickly, Cathy, what's the assessment for your particular micro-credential?
So as I mentioned earlier, so it's a scenario planning document, which is the written part, which basically is a document on a problem that you have found that you need to deliver simulation training on, and you then implement that into a scenario planning document that you can use going forward. There is a bit of theoretical side up to it that you do need to have an understanding, and that's obviously we cover within the micro-credential. And then there's an OSCE exam. And the OSCE exam is very much about running the simulation you have developed in a practical exam using, and the participants of the micro-credential all partake in that. It's a lovely learning. So we divide groups, and it's a lovely learning environment, and we all work together. You might decide you want to do it as pairs, or you might want to do it individually. So it's there's the theory element, and then there's the practical doing element as well.
Yeah, and I think it comes back to what we were talking about earlier, is that as you're going through the micro-credential, you're actually doing that piece of work to have impact in your workplace as part of the assessment. So it's not here you go and then go and do an exam. It's more building on what you're learning and actually kind of integrating. The assessment is nearly integrated into the whole duration of the micro-credential. And is that similar for yourself, Roman?
Thank you. So in my case, as I said earlier, we value so much the life educational experience that we set a pass mark that includes attending at least 8 out of the 10 sessions live. Of course, you see, you might just get some issues and perhaps you need to tell us, I've watched a recording. That's okay, but we'll ask you to tell us that you've watched a recording, because we really value you being there, because we will be having certain bit of conversations. These are not large classes. These are classes that have been minimized so that there can be a little bit of discussion and dialogue. And I like that. I really like to promote that. So you will like the live sessions more. So you need to come at least to 8 out of these 10 sessions. In addition, at the end of the module, then there is a reflective assignment. So there's many ways of assessing. Of course, it could be MCQs and examinations and OSCEs and all that. But for this particular micro-credential, we decided that the reflective assignment would be in order, because it's about you telling us what you've learned. And it's about you actually writing how the assessment and management of frailty, the way you've understood it from the course, adds value to a real clinical practice scenario in an environment that you're familiar with. So you kind of reflect a little bit on your learning, and it's really interesting and fresh. It's not an academic assignment. It's more like a piece of your mind. And it's really gratifying to see, you know, what people write, and it's only 1,500, 3,000 words. So it's a very short assignment, but it's an enjoyable one, because you will be telling us what you learned and how you think that you will apply that to your particular profession.
And I think that's really interesting, Roman, and we've seen that right across our profile of micro-credentials in Trinity. We've about 40 micro-credentials running at the moment. And that applied approach that Cathy talked about there for assessment, and then Roman, that reflective approach, are very much embedded in all of our micro-credentials, because it's very much about what you're learning through the micro-credential and how that's going to develop your skills, and for you to acknowledge and to be able to be aware of the skills you've developed through doing it. We're just coming to the end of the session, everyone. I know it was very short and sweet, and thanks to everyone for putting some very interesting questions in the chat. I might ask Aggie, because we have had 1 or 2 questions about how can I apply and where do I go to get more information. So Aggie's just going to share a slide here. So there is a website that has details of all the health and social care micro-credentials that we offer in Trinity. So we've given the website link there, and also if you scan that QR code, it'll bring you directly to that website as well. There's also a section on our website on the fee subsidy, so you'll get a lot more information there about how to apply and the information you need to apply for the subsidy. And if you've any questions at all on anything that's come up at today's webinar or about micro-credentials in Trinity in general, you can email us at microcredentials@tcd.ie, and my team will get back to you, and hopefully we'll be able to answer your query. I'd like to thank Cathy and Roman so much for joining us today. It's been great to hear from you both and to get your insights. Cathy, from running a very successful micro-credential, and Roman, as you prepare to deliver your micro-credential for the first time. So thank you both for your input today and for sharing your insights. I think we all learned a lot from that. Just want to mention that we have 2 more webinars in this series, one on the 19th of June on advancing societal change, and one on the 20th of June on mastering strategic and effective leadership. So please, I'd invite you to go and register for those webinars if you'd like to hear more. We'll have other micro-credential leaders from Trinity having a discussion on the day about those 2 topics. So please go ahead and register, and we look forward to seeing you there. And hopefully we look forward to receiving some applications for Cathy and Roman's micro-credentials, which will start in September soon. So thank you everyone for joining us today. It's been a really interesting discussion. Thanks, Aggie, for providing all the technical support and making sure we kept the show on the road. So have a lovely afternoon, everyone, and we hope to hear from you again soon.